Welcome, ladies and gentlemen. My name is Emmanuel N, and I'm here with Dr. Noel Tancinco, who is an internal medicinist.
Hi. It's a pleasure to be here with Greg to kind of discuss and give more insight or information about my work.
Yeah. So where do you work at?
I'm currently working as internal medicine hospitalist at St. Vincent.
St. Vincent?
In Hot Springs, and which is most, it's kind of 1.5 hours from here. So
yeah, gotcha, great. So what initially piqued your curiosity in medicine, and how has your perspective on the field kind of evolved over time?
It's a long story. But I'll tell you. So I came from a family of physician, engineer.
Yes.
What else? Biochemist.
Yeah.
Pharmacist, and so I was so lucky that I was surrounded by all of them.
Yeah.
And so they even when I was a kid, they were already talking to me about, okay, this is what I do. And then actually when my grandfather taught, he's a electrical, mechanical, and chemical engineer.
Wow.
And he said, I think you should be an engineer. So at the age of 9 years old during summertime, he already taught me how to make a radio.
Wow. That's cool.
And also he taught me how to make when I was a kid, I enjoyed playing robots or something. So he already taught me how to do those, which is like very innovative, and so I enjoyed those. And then my grandmother was a professor of obstetrics and gynecology, and so she was taking me sometimes in the hospital and showing me her patient. And sometimes it happened because nobody can. My parents are working, and so she has to take me in there. So she's kind of babysitting me as well. So I was exposed to that, and then my aunt, she has no children, and so she's like my second mother. Yes, and so she was the one teaching me. She's a retired nuclear physicist and biochemist, and so she was the one teaching me about if I have questions in my homework. And she's, even though when I was in high school, she's already at the back teaching me already.
Big influence. Gotcha.
Yes. And so later on, I enjoyed both sciences and math.
Yeah,
and
it just kind of connected together.
And so I ended up actually I was geared towards math, and I was in my school. They assigned me to compete in math Olympiad.
Gotcha.
And so my grandfather said, I think you should be an engineer. Then I said I can be an engineer, but let's see. So my parents have they don't have much money, and so the easiest way to get out of, I came from the Philippines, which is a third world country.
Yeah.
And so the easiest way to improve our economic status is either going to become a nurse or a physical therapist, which I ended up going to physical therapy because I enjoyed science, and at the same time I enjoyed mechanics.
Yeah.
And which so I ended up going to Bachelor of Science in Physical Therapy. Then after that, I took the board exam. I
Yeah.
was lucky. I ended up became number 2 in the whole Philippines
Wow.
for physical therapy board exam. So I was lucky on that. Then, of course, I thought I can leave the Philippines so
Yeah.
easy with that, but it's life is not so perfect.
Yeah.
And so I ended up teaching in physical therapy
Yes.
school. So still 3 years, I was still in the Philippines. So I got a little bit frustrated. And so I asked so that frustration, of course, didn't pull me down.
Yeah.
So I asked my grandfather and my aunt to kind of assist me financially in medical school while I'm waiting to go to the United States, which they said okay. So I was luckily I was able to get into med school in the Philippines.
Yeah.
That's how I became a physician.
That's a
It is
really
not.
cool.
It is not the plan it just so happened.
Yeah, but it was like a personal sort of development. I mean, your aunt and your grandfather and everything. That's really cool to hear about.
That's right.
If there were any other healthcare related jobs that you would have chosen that wasn't internal medicine, which one would you have chosen?
Well, actually, the consequences or sequence of events that happened to me. So when I came here in the Philippines,
Yes.
here in the United States, I worked as a physical therapist.
Gotcha.
Okay, so that I already achieved what I want. So I worked from 2003 to 2005
Yes.
at a nursing home in Hot Springs and outpatient physical therapy. I have to work as much as I can because I have to prepare for going to residency.
Yeah.
And at that time, I don't have medical license yet. So it's kind of expensive to take all the board exam and have all the interviews. So for 2 years, I work as PT, kind of have fun for me to go into to take all the USMLE steps 1, 2, 3, and go to residency. So I was able to get I enjoyed physical therapy, so I was able to apply it here.
Gotcha. That's really cool to hear about. Are there any like time constraints whenever you are seeing your patients? This is in like the patient care and treatment category. Yeah. Are there any like time constraints or like, yeah, whenever you do see your patients?
Yes. A lot of time constraints. Right now it's not. Right now, the patients has for some reason I think there's more cases. I don't know if it is just happen with the type of diet this our patients are getting, or because we probably had also more diagnostic and we diagnose patients right now. So it's multitude of time constraints, including the requirements in the hospital.
Yeah.
Hospital policy, number of days of stay in the hospital, insurance issues as well, and if the patient has no insurance. So those are the constraints.
Gotcha.
Now, it's a good thing right now that the hospital has multidisciplinary rounds, that we have case management, so kind of help me to plan for the patient. And of course, in the morning I have to round so early, so I have plans on each patient properly.
Gotcha.
So those are the time constraints, and I have to of course those patients have families as well that I need to have more time to kind of talk with them. So those are the constraints, which for me, I enjoy doing those puzzles, but it is a challenging
part. How much like average patients do you kind of go through a day? Do you have like an average? Or
Yeah. For easy day
Yeah.
during the right now it's what, springtime.
Springtime.
Our census is going down now in
Yeah.
the 17, 18. Those are easy, but
Yeah.
during the winter season, I'm so glad we're done with the
Yeah,
winter
with the
season.
the flu, and
Yeah,
Yeah.
it was in the average of 23 to 25
23 to
patients.
25
And at the same time, I also handle long-term care patients, which
Yeah.
is in the hospital. Those patients who are on the prolonged mechanical ventilator, that
Mhm.
they have a tracheostomy. So I
Yeah.
have to see all of those, which it's enjoyable
Yeah.
for me. It's not enjoyable for the patient, but yes, the average around 25, most like 25 to 35 patients a
Gotcha.
day.
Okay. Cool. Um, what are some factors that can cause seeing a patient longer, or like meeting with the patient to take longer? Are there any factors?
Oh yeah, it's multifactorial.
Multifactorial.
First of all, each patient is unique.
Yes.
So, of course, the severity of the case, the age of the patient, the social economic situation of the patient, those are the factors that affect that can increase my requirement to see the patient. And of course, you have to listen in detail for the patient, what their needs, what are the symptoms and everything,
Yeah.
before you can have a final diagnosis and work up and the plan.
Gotcha. Okay, cool. Next question. So, how do you balance the need for thoroughness in diagnostic with the pressure of time constraints?
Okay, so since my schedule is like 1 week on, 1 week off, I
Yeah.
have that in that 1 week, I have to be really on time.
On time.
So I wake up early morning
Mm-hmm.
to kind of talk to the patient already
Yes.
and have plans. So so that will help me prepare for each patient for
Each
the whole
patient.
day.
Gotcha.
And of course, you have to kind of be prepared for
Yeah.
something that you're not
Not
expecting.
exactly.
Like emergency.
Uh-huh.
Some of them, they crash on the floor
Wow.
or in the ICU. So I have to prepare. So everything has to be in time.
In
So
time.
I'm already in the hospital like 5 a.m.
Gotcha. Okay. Next. So, what's the craziest patient story that you have?
Oh gosh, I have so many crazy stories.
Crazy
But
stories.
I think on top of my head, the one that I remembered is, yeah, this is I think she's 80, 82, something
82.
that range.
Yeah.
And she has multiple medical issues, like she advanced age.
Yeah.
Her mental state is no longer as perfect.
That's perfect. Exactly.
Yeah, and she has atrial fibrillation, which is
Mhm.
irregular heart rhythm. She had history of GI bleed.
Oh.
She has she's also diabetic. She's
Mhm.
kind of, there are gradings of size wise.
Yeah.
There's obesity, so she's also in that range. But anyway, she was admitted to I inherited this patient from my coworkers.
Coworker.
So this patient has been in the hospital for a week.
A week.
And this patient was initially admitted as confusion, and they found a pneumonia on the patient. Well, it got complicated with stroke
Mhm.
because the patient is not on a blood thinner. If you have atrial fibrillation, the heart it's not contracting normal contraction, and so it became stagnant and develop a clot, and through blood clots. And so we have to discuss with the patient, of course, the patient's confused. So I was able to get in touch with the with the daughter who's very active with the care,
Mm-hmm.
and she said, "Do everything." Okay, all right. So I have to explain the risk and
Yeah.
benefits of giving a clot buster on this patient. So luckily, she ended up uh, from that having a stroke, we were able to reverse the stroke because we were able to see the within the 4 hour time frame.
Yeah.
And then this patient also developed pneumonia
Oh.
and so many things.
Yeah.
So anyway, the daughter was not ready for comfort care hospice, and so she actually cried and she asked for more plans, and so
More
I
plans.
changed the antibiotic to more aggressive
Aggressive.
antibiotic from the common pneumonia coverage to possibility of aspiration pneumonia. And at the same time, I also looked at what are because she became so confused. Most likely, they were pointing at infection and the
Yeah.
stroke as the cause of her confusion.
Mm-hmm.
Of course, it's good thing that I took up American Board of Anti-Aging and Functional Medicine, which is great thing because I was able to apply even in the hospital. So I ended up like diagnosing and finding out so many multiple issues on this old woman, like mitochondrial dysfunction, and of course, which is mitochondria is a powerhouse of the cell.
The cell.
So I kind of gave all those vitamins, thiamine,
Mhm.
folate, multivitamins, zinc, vitamin C, high dose of vitamin C, and all of those. And I was surprised that the patient got better. And from we call it functional quadriplegia, like those patients that are not able to function anymore, and she was able to go back to her previous level in which she was ambulatory,
Yeah.
talking, and we're able to discharge the patient
That's really good.
to rehab.
Yeah. Still a very good improvement. Moving on, what are some ways to improve heart health?
Heart health,
Yes.
there's so many ways.
So many ways.
Heart problems, heart attack, heart failure, they're almost the number one, I think. The number one causes
Cause of death.
of death.
Mm-hmm.
I think even worse or almost second to number more than cancer
Yeah.
or COPD from the from COPD from the smoking. So because our heart is connected to
Kind of everything, right?
everything.
Yeah.
So how do you say this one? So what's the question again?
Sorry, the question is what are some ways people can improve cardiovascular health?
Yeah. So number one is diet.
Dieting.
Whatever we take in,
Mhm.
it will cause like high lipids,
Yeah.
can cause atherosclerosis, cause plaque formation, then cause myocardial infarction.
Mhm.
Then high salt can cause heart failure
Yeah.
because that increases your water retention, high blood pressure. Then stress can cause heart issues. So I think the balance of the diet, also exercise, and managing your stress are important for a healthy heart.
Gotcha. Also, what roles, like you were talking about, lifestyle roles play into your overall health a lot. Speaking about lifestyle roles, what are the differences between modern medicine and alternative medicine, and how does that relate to your thoughts?
I actually like that question. I really love it because I've been in working as an internist, hospital based after my residency. So from 2008 until till present, that was how many years? Like 15 years.
15 years, wow.
Working in there, and um, so for that, I kind of got into like seeing so many cases in the hospital. Like, how can we prevent this from happening? So I got into curiosity of studying. Right now we're in the United States, so this is a modern medicine, but how can we prevent it? I think what I did is I studied anti-aging and functional medicine, which some of this are came from Eastern medicine, like China, and some also came from other parts of the country, not only from the Eastern.
Yeah.
And so those are the alternative medicine. And so by combining all of those, I think that will like those herbals, and what else? Acupuncture, yoga, and everything. Those are very helpful to prevent into the acute care.
Gotcha.
And prevention of seeing me in the hospital.
So I actually kind of got it was introduced into like Western and Eastern medicine terms from this book by Djokovic. He kind of talked about just how, or the different types of medicine there, and like how stopping to eat gluten. I think he was like allergic to gluten or something, actually, which was kind of weird because his parents owned a pizza shop. It's kind of funny.
Can you give me a little bit detail on what, like, the gist? So is he, because there are, in the Western or traditional medicine, they say that celiac disease came. The cause of that is gluten diet. Gluten can cause celiac disease, but now, like, it's good thing right now that is that people are educated that gluten can cause so many illnesses that like even how do you say this one, because gluten can increase the what do you call this one, in our lining of the intestinal tract. The gap junctions open up. So those because of the gluten, that increases the gap junctions to open, and then our intestinal tract inside, those bacteria can cross the intestinal tract blood barrier, and increases autoimmune disorder. So Djokovic went into this issue that he was diagnosed with gluten, with celiac disease, or is it just found out?
I think he was actually diagnosed with celiac disease. I think that's why quitting gluten was super effective for him. Actually, I mean, he said that he felt like a completely different person. He stopped eating gluten, and he was waking up feeling refreshed. And it was in like the middle of I think he was doing kind of bad in tennis. I'm not completely sure what year it was, but it was like 2000, maybe 2010, 2011. But like afterwards, he had one of his best years ever. I think 2013 he won 3 Grand Slams. He went on like a 50 match win streak. It was insane. Yeah, it was a big change for him.
Wow. So I am really interested about that, and with anti-aging and functional medicine. Whatever you take in, like the gluten, and then not much vegetables,
Yeah.
it increases your risk of getting into autoimmune issues. Even though there's no specific autoimmune issues, it can also increase of problems with how do you say this one? Um, Sometimes mental issues can be
Yeah.
from whatever you take as well, which some other people are they don't believe in that. But with all my studies, I think they said that adequate fibers,
Fiber.
vegetables, fruits, and gluten free will prevent you from going into chronic illnesses.
Yeah.
And of course, fish, those have
Mm-hmm.
high omega 3 and 6 that can prevent you into atherosclerosis and heart disease. So mainly whatever you take in
Yeah.
is what you're going to have in the future.
Yeah, gotcha. Are there any like common misconceptions that your patients kind of have, and how do you kind of correct that, or like?
Yeah. Yes. It is very important for the patient to kind of so that they will be compliant with
Yeah.
with the treatment plan. You have to listen to them.
Mhm.
Okay, they will say like, hey, I actually they said alcohol is good for you. Okay, but you have to drink moderately because they said alcohol has like for example the red wine. They says that it has resveratrol and that improves dilatation of the blood vessel for
Yeah.
somebody with heart disease. So what my point is, you have to you have to educate the patient what they think. You have to listen, you have to explain to them in explain to them in detail, and so that they will follow what, so to prevent them, like some patient that I have has history of alcoholic liver dysfunction.
Yeah.
So you have to tell them, okay, it is good, but in your case, you already have some damage already in the
Yeah.
liver. So you have to explain everything to them.
Gotcha. That's great. What % of your time would you say is spent on paperwork?
Oh yeah. Before, many years ago, it was easy, and talking to the patient, and then I have to just not, we don't have electronic medical records before,
Yeah.
so it's easy to talk to the patient and then scribble about the progress note and write the plan for the patient. But nowadays, I think I spend almost 50%.
Almost 50%.
But
Wow.
almost 50% of my 100% time, 50% patient, 50% of the documentation.
Documentation.
But it does not stop me in there. So what I do is, our number one priority is the patient.
Patient.
So I see the patient early, and then I'll put my documentation later on. Even sometimes I have to extend my time in the evening to write the proper documentation. But yeah, number one is patient care.
Patients. Gotcha. Now on to like our next category, advances in medicine and technology. How do you think AI will affect the future of medicine? Like a more accurate diagnostic or diagnosis, drug development, or like health paperwork?
Yeah. Well, I am so happy that there is AI right now, but there are advantages and disadvantages on
Yes.
that. Advantage is you can I feel more efficient right now in documentation
Yeah.
using AI, but also at the same time it helps me find out for example, there's a very rare case that I have to look at, then I can just input the information to the AI.
To the AI.
But still, I have to talk to the patient
Yeah.
in detail because each patient is unique. So I still that is a good thing to help me add more to the workup, especially with advances in medicine. You cannot just remember everything about the management, right? And so that is the advantage. And disadvantages, some other physicians or healthcare workers like nurse practitioners or physician assistants, so some of them or some of us, let's say, they're dependent because it's easy to look at the AI.
Yeah.
But we should not be dependent on that because still you're the one seeing the patient and interacting with the patient. So we should not be dependent on the workup or the plans through the AI. So it's, in other words, it's a good tool, but we should
use it as a tool, not
as a tool.
decider.
Exactly.
Gotcha. Do you think AI will ever replace doctors altogether, or do you think that's kind of not?
I really don't agree with the AI going to be replacing physician because let's say an example.
Yeah.
When you're riding in an airplane, there is a pilot, right?
Yes.
They have autopilot, right? From the takeoff, it's a pilot is the one managing. But when the patient is already when the plane is already above certain level or feet, it's already autopilot.
Yes.
And then if there's something going on the way or something, it is still the pilot makes a decision and doing all the maneuvers.
Yeah.
Same thing in the healthcare system. We have the physician is the pilot.
Yeah.
Okay. So this AI will give us the plans.
Plans too.
And so still it's the physician will make the plan.
Gotcha. Okay. On to our next question. How has telemedicine impacted your practice positively and negatively?
Right now I am working as a hospitalist, but my passion right now is going into prevention. So that's why I took into this American Board of Obesity Medicine and American Board of Anti-Aging, which at some point in the future I plan on opening a clinic on that. So for example, if I have the several patients in Arkansas that I have to see them, telemedicine will be a great tool for follow-up, or if they need anything that, for example, just in case they're not able to see me, then it's easy for me to just talk to me through the telehealth and give the medication that they need.
Yeah.
And the disadvantage on that is, of course, you don't see the actual, the face-to-face. It's different from looking at the video or the virtual.
Yeah.
So what if it will be a new patient, I would rather have the patient see me first as initial, and then for follow-up might be if the patient has no time, they can just talk to me through telehealth.
Yeah. That's great. And I think it also gives some rural areas maybe more access to more physicians and more material. I mean, it's better than nothing.
That's right. Actually, that is it's good thing that there is a telehealth right now. So we can reach those patients who are far from the clinic.
Much better than Google, I think. Don't Google your symptoms. Usually, that's Google is not a medical doctor. Not recommended.
Yes. And some of those patients, they will just say, okay, I didn't go to your clinic or my primary care physician because I know what to do by doing a Google or something. So I think telemedicine is a good thing. To do that. At least it's easier for the patient to ask the physician.
Yes, gotcha. Okay, now on to our next category, which is challenges and issues. In your experience, what are some of the biggest challenges whenever facing internal medicine doctors today, and how do you think the field can overcome them?
Okay. Yes. Challenges number one. So many challenges. Right now, it's first is the patient's social economic status. Of course, their knowledge and everything is different from those who are some people who are able to have more education.
More education.
So that is number one. Second is insurance.
Insurance,
and that also affects how to manage the patient. And the third is the hospital policy. In my case, in my situation, but of course, that should not be a, how do you say this one? Those are challenges, but there are ways to kind of these challenges can be overcome. So we have right now the hospital has case management that will help me during the multidisciplinary round. I can tell, okay, this patient has some insurance issues. Can you handle this? So and then there's like also this patient has some psychiatric issues. Can we have see this patient? And at the same time, so those are the things that are challenging. But I think with all of these co-workers and in the hospital that are ancillary, they help us.
Gotcha. Okay. Next question. So, like, how do you handle situations where there are conflicting opinions between specialists?
Oh yeah, it happens sometimes. It happens sometimes, and there are some cases that it's multi-organ dysfunction in one patient. So we have to consult cardiology or sometimes cardiology with nephrology because, for example, the patient has congestive heart failure, and of course at the same time they have kidney dysfunction. Cardiac, they don't want to be congestive heart failure. They don't want to be overloaded with fluid. Kidney, they want to be with the fluid. So it is a balance. And so as an internal medicine physician, which we call them as the common final pathway. The intermediary. So I am the one seeing the patient, and so I look at each, and then I talk to. For example, one cardiologist will say, "Okay, well, let's start. Start on diuresing or giving IV diuretic on this patient because it's fluid overload." Well, when you see the patient's laboratory is already trending up in the ground, actually the patient is dry, and so I end up talking to the nephrology. Nephrology will say, "I think there should be a balance," and so they kind of have different opinions, and so I end up like talking to both of them and in a nice way, and then we have a final plan and actually works well after talking to them.
That's really good. What are the most pressing issues in patient care, especially in like accessibility and cost?
Nowadays there's economic is very difficult right now. So number one is economy, socioeconomic situation. And so we have great thing like case management to kind of help taking care of these patients, and they know those ways on how to, if the patient needs this kind of medication, we have case management to ask for funding from the government to help with the medication. That is the number one. So socioeconomic, and then next is the patient's education. Some of them are kind of on. They believe on what they're brought up, and so that is another issues, and of course mental issues. And so you have to kind of take into consideration all of this, and so I ended up like asking help from psychiatry, or me as well sometimes, if it's if I can just handle by talking to the patient and kind of educate them, and also have a good rapport to the patient, then most likely it kind of help me managing and dealing with them.
Gotcha. That's good. Okay, now on to doctor-patient relationships. So in like an ideal doctor-patient relationship, what should a patient do to kind of help make treating easier?
Yes. So that's why I round so early. So I see the patients in the morning and talk to them. Some of them, they kind of get upset because I am already there at 5:30 or 5 a.m. And so I explain to them that I am handling several patients. So forgive me for seeing some of you are early.
Yeah.
And so I try my best to have a good patient rapport and family talk to the family who's in the room, kind of giving more information about the patient. So number one is rapport. Physician rapport to the patient. Educating them is very important. Yes.
And having a patient that's willing to listen is really, really important to kind of having a good relationship and really understanding each other well.
Yes, because patient compliance is will have a very high impact when you educate them.
Yes. Gotcha. Have there ever been any instances where patients were lying or not trusting you?
Oh yeah, that is that is a very difficult part. Always. And it happens on me with all my experiences, not all but some of them, and it really waste my time.
Yeah.
And I am so sorry to say that one. And so I think with my experience, what I do is I sometimes ask help from the nurse, from the case management to kind of, or sometimes with the nurse manager to talk to the patient with me and explain everything. I think it helps in facilitating on patients patient-doctor relationship with the help of sometimes of your coworkers. So then, that is a difficult when the patient does not, they don't trust, or sometimes they have a different idea on how to manage. So that is the problem. But of course, you have to talk to them.
Educating your patient is very important.
And some of them are, of course, some have mental issues, which is you cannot avoid that one. So so you have to talk in a calm, respectful manner, even and ask help from your coworker or from a psychiatrist or something to kind of talk and deal with this patient.
Gotcha. And also, I think like education is very important. I think especially in rural areas, there might be a little lack of education there. So education is super important, and I think that also connects to rural healthcare and like preventative medicine. If you can prevent them from getting sick, that would be the best thing for their health, because they won't be sick.
That's right. Right. Yes. And that's right now I'm passionate on doing for the preventive medicine. But the number one causes of admission in the hospital is patient not like eating what they want, or sometimes lack of exercise, and so weight is the problem. Some people are morbidly obese and they
Yes.
get into this bad diabetic complications.
Yeah.
And so I believe that going into the diabetic complications, you have to educate this patient. And of course, as a physician, I was many years ago, I was on the heavy side, which is funny, and shame on me. So I was there's something like practice what you preach. And so it was embarrassing when I was telling them to lose weight so that you will have a better get into the bad diabetic complications. And so I tried my best to change my lifestyle. So right now it was a big loss of weight, and people are more receptive on that now. Listening to you when you're actually in a good shape.
Gotcha. That's a very inspiring story to hear, and that's great. Now on to our next topic, which is future of internal medicine. Also, forgot to mention that Arkansas, I'm pretty sure, is like top 5 in terms of obesity rates, which is kind of insane. So that is something I think we should all focus on, lowering that rate, and educating people more is a factor in lowering that.
That's true. So when I took the American Board of Obesity Medicine, actually there are questions in there, and it showed you're correct. The southern states, Arkansas, Mississippi, they're in the red line. They're in the red map of obesity and have problems with complications after that. And so, I think what I heard right now is increasing or getting more into the educating them and also have the more physicians opening for residency, I believe, right now, and reaching the rural areas, and that improves the healthcare system, particularly in the rural areas.
Gotcha. Okay, now on to our next topic, future of internal medicine. Is there anything that excites you about the future of healthcare?
Yes. For the past many years, they are saying that, okay, Western medicine is the answer to all the issues. And then if you're in the other side, like, okay, the alternative medicine are kind of, they say, placebo or quacks, or which is, that was many years ago. Now they're opening up more training that, like, for example, the functional anti-aging herbs have less side effects as compared to the traditional or medicine. So in short, like, there are some herbs or other herbs or actually some acupuncture, and what else, yoga or stress reducing are helpful to prevent this patient go into requiring Western medicine, which is actually both of these works hand in hand, which is most likely the future of medicine.
Yeah, and I think that also connects to kind of our charity's mission. Improving your overall health is the best way to avoid getting sick, and practicing healthy habits is very, very important. Okay, now on to our final question. For young medical professionals interested in pursuing a career in internal medicine, or just medicine in general, what advice would you give to them to help them succeed?
Okay. Yes. Of course, just I know that you're interested in
that.
So, my advice is, of course, you have to sit down and study. Of course, that's number one. But you also have to balance it with other things like sports, and because I know to go into medical field, it's very time. How do you say this?
Consuming.
Time consuming. So you really need to have how do you say this one?
Like a balance.
Balance. You need to have diligence in studying, and at the same time, for example, when you're already like, okay, I feel like I'm going to vomit after so much information overload. So what I do is I kind of go out and take a deep breath, and then after 20-30 minutes I go back and study again. And then later on in the afternoon I go to the gym, and sometimes I ask your dad to play tennis with me because I'm going. But anyway, so in short, you have to balance everything.
Balance is very important.
Studies, you need to do time management. You have to time management, and you know how to do relaxation techniques so that you can go into this long time of study.
Yeah, so balanced lifestyle, healthy lifestyle, and also practicing what you preach, kind of all connect together.
That's right.
But yeah, I think that was our last question. It was really nice having Dr. Emmanuel Tancinco to come on here for our first podcast episode.
Thank you.
It's a nice. Thank you so much for tuning in and watching this episode. If you would like more episodes, comment down below, and I'll catch you guys in the next one.
All
See
right.
ya.
See ya.